What's up, guys? Welcome back to another episode of the BlockHash Podcast. Today, I have Michael Dershem, CEO and founder of Apierion, a seasoned entrepreneur with over 20 years of experience in business development, capital sourcing, technology transfer, here to talk about what they're doing at Apierion. Michael, welcome to the show, man. How you doing today? How's your week been going?
Things are good, man. It's a little hot outside of Philadelphia, but other than that, things are good.
Well, before we jump into Apierion, would love to talk about you a little bit, if you don't mind sharing your story. I'm sure people will be curious to maybe who you are and your background and maybe what you did prior.
Yeah, for sure. And Brandon, thanks again for the invite. I was really looking forward to it. So, like Brandon said, Michael Dershem, aka Dersh. I've been a serial entrepreneur pretty much my entire business career. Started the first companies in my mid-20s. And they've all been primarily in the greater healthcare and pharma space, ranging from distribution and operation companies. We built the first reverse distributor ever licensed by the FDA and DEA to cure some supply chain ills within the pharma marketplace and supply chain. Also was one of the first movers to put docs and nurses in alternative sites like Walmarts and grocery stores and pharmacies when everybody thought that was crazy. And then you fast forward to the pandemic and that was the first line of offense and defense that we had. I was also the founding CEO of Pharmacet, which was the hepatitis C company that we brought out of Emory University, which eventually went public and then led to the drugs Harvoni and Sovaldi, which for all intents and purposes eradicating hepatitis C across the globe. So that's primarily my business background. And then we started Apierion formally as MAPay, that we started a little over 6 years ago as a payments company, which then found that we had access to data. And we thought that by building that patient-centric way of driving data, we could really kind of collapse in on this whole notion of interoperability of data within the healthcare space.
What was the original goal behind wanting to start Apierion? Was there like a desire to help fix and facilitate in a better way healthcare data from personal experience, or just seeing it in the industry, or just having an idea of how to solve that problem? Like, what was the inspiration?
Yeah, it was pretty interesting. We brought in a couple predecessor companies, and again, this is kind of a pre-blockchain, and we wanted to solve the dysfunction of healthcare payments in the States, whereby we created some technology whereby a patient could pay any provider regardless of who that was under one platform. And that was MEDspedia, the patient-facing side. So in other words, I could pay my hospital bill, my dental bill, my chiropractor all in one place and have archived history on that. As we were curing that ill, we found that we had access to all the data that said why Brandon owes this hospital $50, which then got us into this notion of, hey, if we were able to pull the payment data and there's clinical data associated with it, we could drive down these siloed out applications within healthcare, which is where this data is walled off. And we have good patent filings around that. We have some issued patents around it. But so that was really, kind of the genesis of it. Let's fix this friction in healthcare payments, which then got us to the data.
So, streamlining payments, protecting healthcare data. Is this more or less in an effort to help kind of democratize the way healthcare is done in a global sense? Because obviously healthcare is a very old bureaucratic system where it takes a lot of time for tech to kind of get integrated, but for anyone to really quite understand and operate and get through. So is that kind of part of your guys' goal as well, to kind of help maybe democratize it a little bit, make it a bit easier, consolidate things?
Yeah, I think so, but there's a lot to, I think, unpack in how you describe it as democratization of this data. Because there's a lot of issues as it relates to data. So, whether it be the security of the data, would it be access to the data from a patient side, would it be permission across borders, things like that. And that's really where we are today. We started our global efforts before the pandemic. We were the first company ever. And that's when we started to deploy some things using distributed ledger and blockchain. And we were the first company ever to sign an entire country where all of their healthcare data, private sector and public sector, both in country and cross border, would ride on digital rails. And that was the country of Bermuda. And that was, I mean, it was fascinating. We signed the agreement, prior to the pandemic. Of course, the pandemic, was painful for everybody across, all industries, but particularly in healthcare and what we were doing to try to make change. But we stayed relevant during the pandemic. We launched some other applications, but back to Bermuda, we found, and here's how it all came down. In healthcare across the globe, it's about $11 trillion industry. But at the end of the day, there's three stakeholders: patients, providers, and payers, government payers, insurance payers. And that's what makes this whole marketplace go round. And what we were able to do in Bermuda was we really shifted our focus from payment to really digital identities and data. And we created the first on-chain digital credentialing app. So what a credential is if I want to see patients, it doesn't matter if I'm in the state of New Jersey, if I'm in Bermuda, if I'm in Colombia, I need to be credentialed or licensed. That process across the globe is totally broken. And so we created a credentialing app for the Bermuda Health Council. So right now, today, if I'm a provider and I'm renewing my license, I use my app, and we create a digital identity of you as a professional, your medical twin. So we call it Pro DT. That rides on chain and then points to the different data sources that make me up as Dr. Dershem.
So that was part of the proof of concept that you guys did in Bermuda.
Yeah, that was a proof of concept, which gave us, one rung of those three legs, and then that allowed us to go into the insurance companies and government payers to build a proof of concept around the organization digital medical twin, because of the exchange of data, the exchange of messaging, and then ultimately payments, which then gave us access to all the patients. And so we have on chain today the digital medical twin pulling in from different data sources, and that rides on chain. All of this allowed us, it's one thing when you're Dex and Vision, and then as you start deploying, the way that we can now point to these applications, because these ills that are within these healthcare systems, it doesn't matter, again, Brandon, if I'm in Colombia, Paraguay, India, Namibia. For all intents and purposes, it's the same stuff, maybe some nuances in between. So we were able to move it throughout a few other South American countries. We're looking to standardize some things within LATAM, working with the regulatory environments. But also we were able to open up and announce 3 states in India where we're building upwards to 200 million digital health registries, which will ride on chain. Probably, arguably, the largest utility of blockchain in any industry, which then allowed us, we're going to be announcing probably by the end of the month, our first country in Africa. So all of these things, we continue to use Bermuda as a microcosm, of which then, when it comes to cross-border care, how is the data permissioned between countries? How is it permissioned, from an individual? All of those things, which now post-COVID, where COVID exposed all the healthcare inequities and healthcare lack of access that we all knew existed, but kind of put a blind eye to it. But, we can't do that anymore, either as, as countries, as global citizens. It's just not acceptable.
The digital medical twin, that's something that is primarily for providers, correct?
Well, what we did was we used our digital medical twin construct for the three stakeholders. So we have my DT, which is the digital medical twin of the patient.
Okay.
We have Pro DT, which is the digital medical twin of the professional. And then we have Org DT, which is the digital medical twin of the enterprise, the hospital, the health system, the insurance company, the government payers, that enterprise, those three stakeholders in medical commerce.
On the patient side of things with that, like what all could be encompassed in that digital twin? Could that be health records? Could that be files or past medical history, diagnoses, illnesses, allergic reactions to things? Are those things that, you can put into that digital twin that, you can take from country to country, wherever you are?
100%. And I think that's where we're driving that digital medical twin. Again, if it's patient driven, patient centric. The issue with data today is that it's locked off in competitive silos. So if we look at it within the states as well as outside the states, it's locked up either into large electronic health record vendors. So, those companies that provide the systems, for clinical records and for patient payments that every doctor's office and hospital and clinic uses. It could be locked up into insurance companies. And these are competing forces. And remember, healthcare data, the value of healthcare data from a big data perspective is 25x payment data, the most prized data that there is. So there's a reason why these competitive natures wall off that siloed data. So going back to the digital medical twin, what we're driving for is to be able to break down those barriers, to build what you referred to earlier, a democratization of that data. We have some really interesting monetization schedules that we're modeling right now. But at the end of the day, what's in that clinical record, like some of the things that you just mentioned, is really, if you talk to provider, is only 20% of the puzzle. We need to collect wearable information. We need to collect what's referred to as social determinants of health, all those environmental aspects that happen. What are the pollution counts in Delhi today that might impact my health? That's might be in a government or other type of data source that is key and critical, but it's not in any clinical record, right? But if we're creating the true digital medical twin, and we can, again, use that phrase, democratize the data and then monetize that data in an exchange format, we believe that we can really incentivize even where that data sits today to come onto our exchange.
So if you were like a patient and let's say you wore like an Apple Watch and you have a bunch of data on your resting heart rate, your activity during the day, how many calories you burn, maybe that's relatable to something that you're going through, and maybe that's helpful data for a practitioner or a provider to have access to. Is that something that would also go into like your digital twin that you could choose to share, wherever you are, like part of your medical chart?
Without a doubt. Like right now on my phone, let's see, I can hit my QR code and permission certain data sets that I want to show that provider. And that's going to be key going forward. Particularly as you want to make sure that it's a true electronic digital representation of the entire Dersh or the entire brand, right? Because without that, if you think about it this way, if clinicians are making calls on lack of data or only the data they have available to them, they could actually be going down wrong rabbit holes because they don't have access to the entire picture of myself, or the entire archived history of, my sons were both, well, still are athletic. I can remember them having concussions on the soccer fields and football fields. Do I have records of those? Would it be nice when they're 26 and they start having some headaches to be able to pull that type of information to that at that time, that clinician? 100%. I mean, it's crazy now that we have more information on our Amazon data, our Amazon purchases from the first time I bought a book, how many years ago, and I have zero access to my healthcare data.
Could this be used for like research purposes as well? Like, let's say you're a doctor, practitioner, provider, hospital, any institution maybe that's doing research, and you could maybe send something out through Apierion system to other users out there, and maybe they can participate or something. I mean, I could see like a medical data economy kind of building here a little bit.
Without a doubt. And we're working with a genetic researcher now in LATAM, and her research is around non-European breast cancer survivors and those that haven't had breast cancer. So they're using our platform not only to collect the information that they're getting from a DNA sequencing and genetic, but also all the other types of information that is available, which will make her research even better, more robust, and more shareable, for those big data buyers. Yeah, and we have, now we have, parts of our team that are dialed into, the aspects of AI. What also interests us, I mean, you bring up a great point about the clinical side, but also if you think about what we've done in creating this digital twin of professionals, if we understand as a region, again, let's take LATAM. If we understand as a region that there is a true lack of pediatric mental health professionals in Jamaica related to adolescent eating disorders, right? I'm just making this up. If we know that today, but yet as population health, as we're projecting out what our needs are, particularly around the pandemic and how that's impacting that, those pediatric patients and young adults, we're able to understand the capacity or inventory that we have, not only as a country, but as a region, and identify through AI what our projected needs are, and come back and fill those gaps today proactively rather than reactively.
How do you imagine this kind of working for people? Is it going to be like an application on your phone, or is it just going to connect to a database? Or
yeah, it's kind of funny. My wife's a physician, and she'll kill me if she hears the podcast, but she would agree to that. She's not tech savvy, and she says to me sometimes, "Dersh, am I going to be like walking down the street and all of a sudden, blockchain hits me, or something?" And we get that question all the time, because I think when we're talking to that audience, or as we're, for instance, in India, starting to get this adoption, to them, it's just an app, right? It's just a simple app that they're used to using every day. What goes on underneath it? Do we really care? Like email, do we really care how that's evolved? Do we really care how Calendly is now able, where you're able to send something and look at mine and put something on my calendar? Do I know how it works? Do I care how it works? All I know is it works, and it's pretty easy. And so we view that the same way. When you and I are talking, or the folks out there, yeah, they want to hear about blockchain applications. They want to hear about 2.5 and Web3. Dersh, do you have any thoughts on AI? I get that, but at the end of the day, it's a simple app that today, like we showed in Bermuda today with my healthcare data.
And what blockchain are you guys tapping into to power this, behind the scenes?
Yes. So we originally started on Algorand, and now we've made the shift to Avalanche, um, and and so but we also believe that at some point to be chain agnostic is is important, and to build bridges. And I think when we look back and see how some of that history repeats itself. When we look at some of the things that were stumbling blocks in Web 1 and Web 2, same things are happening now, in blockchain applications. But we see the need for, again, the best way to describe it, that those bridges of interoperability, if you will, within chains as well.
Any particular reason why Avalanche? Just scalability thing, or?
I think scalability, enterprise. Also, when we talk to major investors, it's a checkbox, right? We don't have to go much further.
I was on your guys' website, and I think you touched on this a little bit earlier anyways, in regards to, consolidating payments and bills and things like that in the medical space for patients. But I saw something called MEDspedia, and I wasn't sure if that was something completely different or exactly what you were talking about before, having this payments portal sort of thing.
Yeah, that's our patient-facing side. That's where people make their payments, and we're launching again in Bermuda. We're going to be launching MEDspedia.bm, which will allow that to happen. But MEDspedia also is patient brand, if you will, that extends beyond payments. So my MEDspedia app has payments, data, and messaging. We think the financial health, the data health, and then the messaging not only to providers and how that platform can work, but also to amongst family members or extensions to information, community information around, for instance, my son had an illness. Is there a way that I can go into a community and start talking about it? And I think that's important. And I think that there's so many fragmented things out there that our goal was to start the credibility, similar to, and I don't want to put us in the likes of Amazon, but similar to what Bezos did, when we bought that first CD or book. He created credibility, created ease, right? And I think if we do that with payment, or we start with somebody with data, and now maybe that's the only thing that they ever do. But just like Bezos, at some point, he knows when to drop off K-cups to me, because I'm running out. But I think that's how we view it. We view that MEDspedia portion as finally a place where I can have all of my familiar things that I need, as it relates to healthcare and my family's healthcare in one spot. And we think the three tenets are financial, data, and communication.
Is there going to be like a fundamental cost to this for patients or users, or is this something that would be done by the providers on their ends, or how would it work in terms of, funding this system, this network that you put together?
So right now, as we're building, we're being funded by either private sector or public sector. There's no cost to the patient, or if the patient, let's say, makes a payment, that goes through regular payment rails, and the cost is associated back to a provider, whoever you're paying. We think it also at some point, as we're able to monetize this data, of course on an opt-in anonymous basis, but as we have some really interesting, again, blockchain related data structures as it relates to how we can even fractionalize your NFT and put that into different baskets, almost like a commodity. And so we believe that at some point, that monetization in a Web3 way comes back to the patient, because right now, like I mentioned earlier, I mean, it's the most prized data there is, and you and I, it's kind of like a Web2 way how Zuck, built, kudos to him, but built, multi-billion-dollar company off of, my mother-in-law putting, my son's birthday picture up on Facebook, right? So,
Right.
but in a Web3 way, and back to your word, democratizing in that sense, I think that's really what's needed. I think for us, there's a way that we can do that, and that comes back down into the patient.
So what are your guys' keys to success here in achieving Apierion's goals? Given how bureaucratic the healthcare system can be these days, is the key to be able to work with government really well? Is the key being able to work with corporations at a certain level? Or what is the strategy that you guys are going to take so that this becomes a fundamental reality for people?
I talk a lot about the causation effect of what we do. And what I mean by that, Brandon, is, for instance, on the Africa continent, we're talking about how we can reduce the rate of maternal mortality, which is, a mother dies during pregnancy. A big issue on that continent, as well as on other continents, and even here in the States. We're talking to a couple states, Pennsylvania in particular, where that has had a major uptick. But the reason I bring that up is, a lot of times people just talk about, tech and, this silver bullet, and it's going to reduce costs, and it's going to do this, and it's going to do right. But I think all of those things are important. But I also think that if we're looking at some of these kind of micro issues that we can solve because we're able to capture the data, that gains trust. It gains adoptability. And I think when we work with governments and private sector, we always start at, in these countries, getting some familiarity with the public sector, driving into the private sector, and then understanding where we can have that first kind of quote unquote low hanging fruit, show credibility. Because if you don't do that, and if you're not building out resources locally, like in India or Namibia or Bermuda or across LATAM, if we're not showing that, I think then, we've lost part of our mission, which is to, help in some of these micro issues, but also help build out something that those locales and those regions can be proud of.
And to follow up on that, what's your guys' roadmap kind of look like here the rest of 2024? Whether it's new services you guys want to offer or things that you want to introduce to the public, or maybe you guys are going to be in a certain location. I'm sure there's a lot of things going on.
It's buckle your chin strap type stuff. It's like, hang on. The reason is because now, remember when I was saying about Dex and Vision, and now we're deploying, and now we're seeing it. We probably have now 40 countries in our pipeline. A lot of talk with large drug pharma companies on some applications, using data, price sustainability, things that I know from my career. And so I think our biggest challenge now is going to, just manage on how can we manage on the execution of this. How can we bring in the requisite capital, and that capital is both financial and human capital, because that's key. I mean, we have a great team now. We continue to build it out, but I think that's our challenge. If I looked out, and I see in 20, at the end of 2024, that we have good scalability in India. We have started adoption in Africa, working with one of the large drug pharma companies in some pricing strategies and modeling using smart contracts, and then show a cross-border standard credential, with a half dozen countries in LATAM. That builds. I mean, for any company, I think that would be phenomenal. For us, we think that's our kind of low watermark, but
Mhm.
but I think we would look at that and be able to. The great thing is we can transfer that to different regions, different countries. It's not like we're building all new tech everywhere we go.
How can someone get in contact with you guys? Maybe they want to work with you. Maybe they want to partner in some kind of way, collaborate, integrate into their systems. Is there an email or resource or form, or just go to the website?
I think if they go to the website, that's great. They can click on the info button, but also too, if you go to Dersh at Apierion.com, I'm always open, so that's cool.
And what if anyone wants to get in contact with you directly? Is LinkedIn the best place, or would you send them somewhere else?
Yeah, LinkedIn's good.
I can imagine. The problem when you try to work globally is the time zones always become an issue.
Yeah.
But Dersh, thanks for taking the time to come on. It's been a really good conversation, and I love talking about the medical space, especially combined with tech. I have a small medical background as well, so it's always fun to kind of hear about new innovations within this industry. And I think what you guys are doing with Apierion is fantastic. So, best of luck to you guys. Keep it going, and excited to be using it in the future as well.
Yeah. Thanks a lot. I appreciate the platform, and we'll keep you apprised of our developments. And if you ever want me back on again, just ping me.
We'll talk soon. Take care. And this was great, man. Again, appreciate it.
All right.